everybody, it's Dr. Amir Rashidian at Mid-Atlantic Chiropractic Center. And today I want to ask you a question, and the question is, do you have back pain? If you do, you're probably wondering, why do I have back pain? What's causing the back pain? How do I get rid of it? And those are valid questions. I don't know if anyone's ever been able to explain it to you in detail, so I'm hoping to do that for you today. First off, the cause of back pain can be several different things, and we're not going to talk about all of them today, because you can have a sprain-strain injury, you can have a muscle pull that would cause back pain, certainly you can have nerve impingement, you could have misalignment, degeneration, and disc damage that can cause back pain. All of those things can cause back pain, and unless you know what's causing the back pain, you certainly cannot fix it, and you can't get rid of it. So why do we have back pain? Let's today talk about discogenic back pain. Discogenic means there's something wrong with the disc. The disc is causing the back pain, hence the word discogenic. And so I have my friend right here, Charlie. You've probably met him before from other videos. Charlie, this is his lower back, and you'll notice the pelvis is here, and these are vertebrae, the bones in the spine, and the space between them are where the discs go. Now, the discs are cartilage. They're soft, and they are designed to promote motion, not shock absorption, but motion. Actually, what absorbs shock is the curvature. Anytime this guy, Charlie, jumps, runs, and lands, that curve is what's absorbing the shock, not the discs. The discs are there for motion. They separate the bones so the bones can move. So first off, years ago, when I was in chiropractic school, and I won't tell you how many decades ago that was, they thought that there's no such thing as actual disc pain. The disc only causes pain when it presses on a nerve. Well, then later we found out there's actually a nerve that apparently didn't exist in humans prior to that time. It did. They just hadn't found it. It's called the recurrent meningeal nerve. There's a nerve that goes from the spinal cord to the actual disc. So if there is injury to the disc, even if it's not pressing on a nerve, it absolutely can cause back pain. It can be severe. So that's called pure discogenic pain, disc damage. Now, how does a disc get damaged? There's so many classifications of that. You've probably heard the slipped disc concept, and that's not truly a medical term. We don't know what whoever came up with the words slip disc, I don't know what they were thinking. But a disc doesn't slip, a disc can tear, and a disc can degenerate. So when it comes to a herniation, there's classifications of herniation. The disc can be herniated, and the technical term would be protrusion. Protrusion means some of the fibers in the front of the disc, or on the side, or in the back, some of those fibers are torn, and what's inside is pushing, causing a small protrusion. That protrusion can be painful by itself, and if it hits one of these nerves, it can cause radicular pain, meaning radiating pain down the leg. The next step would be a herniation, which means the disc can extrude out. So a disc extrusion, that means it's torn all the way, and the center, which is the nucleus of it, nucleus pulposus, it's like a gelatinous substance, it can actually come through. And that can be extremely painful. Typically a herniation, which can be the three classifications of protrusion, extrusion, and sequestration, those are trauma related. You have to have trauma to have those happen. The third one, sequestration, is when the disc herniates out and then slips down and affects multiple levels in the spine. It actually can press on the spinal cord itself. So those are pretty serious. Sometimes don't need surgery. Now, we've had success with that using things like decompression therapy, multiple different techniques like coxflexion distraction is a decompression therapy, so is Kennedy decompression. Those require special equipment. We can actually decompress a disc, create a vacuum within that disc to suction the disc back into place. It's a process. It doesn't go away right away. The most serious disc herniations can take as long as 6 months to start to feel better. So if you don't want surgery, or if there is surgery, this is a nice non-invasive technique that can help you. The last one is called disc bulge. You've probably heard it. People walk around going, I have a bulge in my back, or I have a disc bulge in my, what has a disc bulge? And is that the same as a herniation? It's absolutely not the same as a herniation. A disc bulge is always degenerative. Remember, I told you herniation is trauma related. The etiology of it is it's trauma. Trauma causes a tear. But a bulge is degenerative, and degenerative means it happens over a long period of time. You can't one day not have a bulge and another day have a big bulge. It doesn't happen that way. So imagine an ice cream sandwich. You've got the two ends and the ice cream's in the middle, and they get pressed together. And what happens is it causes the ice cream to bulge out. Where if these two bones get pressed together, this disc inside will bulge outward. A bulge will not be directional. So when you look at an MRI report, when the radiology report comes in and it says a disc is protruding to the right, that's directional. That's not a bulge. That's not degenerative. It's trauma related. But if it says a paracentral bulge, meaning the whole it's bulging all around in every direction, that is degenerative. Typically that's because there was a misalignment or an old trauma that over time led to degenerative changes. And that disc is getting dry and narrow and narrow. As it bulges out, it can narrow the space and still press on discs. Again, what we need to do is mobilize and then stabilize, which is what chiropractic can do for you. So hopefully that helps explain some of those questions you had about why do I have back pain, and is it a slip disc, and is it a bulging disc, and what does that mean? Well, the treatment is different depending on each one of those, but I do want you to remember, if there's a big misalignment in your spine causing disc injury or causing a nerve interference, getting an injection to your spine will make you feel better. But unfortunately, to get the correction done, you actually have to get an adjustment. And if you have back pain and you don't know what the cause is, but you're taking a pill, and that pill is going into your stomach, getting absorbed into your bloodstream, and taking away the pain, it's not fixing the problem. It's masking the problem. If the oil light comes on in your car and you put a piece of duct tape over it and keep driving, is the problem gone or is it still there? It's okay to take medication. I'm not against that. It's okay to get the injections to feel better. But pursue some chiropractic care too to find out what's causing the problem and get it fixed once and for all. It's about protecting your quality of life moving forward. Because one last thing, if you leave it alone, what's going to happen? Is it going to get better by itself? Especially if it's degenerative, it's going to progress and keep getting worse. And it may get to the point where surgery becomes our only option. Let's avoid that. Hope that was helpful. And we're going to talk about more causes of back pain in future videos, so tune in. Also, if you want exercises about back issues, we have a list of exercises on this same very YouTube channel. If you search for exercises, or if you look at what we call templates, there's there's 5 templates, but I just want you to worry about the first 3. And if you don't have a lot of back pain, but you want to strengthen your back, start with template 1. Do the template 1 exercises for about 60 days. Then move up to template 2 and do that for 90 days, and then move up to template 3 and stay on template 3 for the rest of your life. And when you get to those templates, you'll know what I mean. So we'll hopefully put the link on this video for you to click on. Take care, and I'll talk to you soon.